ASQSE2, the recently updated version of the ASQSE. The ASQSE2 is a parent-completed questionnaire that accurately identifies young children at risk for social or emotional difficulties. Ideally, the teacher completes the questionnaire as an interview with the parent during registration. The ASQSE2 is organized into 7 key behavioral areas to help teachers understand the organization of the tool and the intent of the individual questions. The ASQSE was revised based on a call from the field. In addition to the fact that it is a good practice to revise assessment tools to reflect feedback and to obtain recent normative data, the authors learned that the ASQSE was being used by practitioners to screen children for possible autism spectrum disorders, or ASD. Items were added to the ASQSE to help those practitioners differentiate young children at risk for ASD from other externalizing and internalizing risks to help guide with referrals and follow-up recommendations. Please remember that the ASQSE2 is a screening tool. Only a professional can diagnose ASD following a thorough evaluation. Revising the ASQSE also served to increase the quality of referrals. Our early childhood funding sources mandate the implementation of a research-based social-emotional screening tool. The ASQSE2 helped lead teachers to develop a deeper understanding of their students' social-emotional development in order to provide the best possible support. Teachers should review the results and meet with parents to discuss the results. Teachers and parents should discuss any next steps that need to be taken. Next steps can include implementation of learning activities that will be provided sometime during the winter of 2016. Intervention activities can be found in the appendix of the user's guide, monitoring, further assessment, or referral. Keep in mind that screening identifies children who are developing on schedule. Children who would benefit from practice and/or support in specific areas may be identified. Children who are at risk for developmental delays who should be referred for further evaluation are identified. Screening answers the question, does this child need an in-depth assessment? Screening is a referral source. It should not be used as the sole source of data and documentation. Screening is a tool that helps inform practice and identify areas of need. Remember that screening does not diagnose delays or disabilities, and that it does not identify specific child goals to target, only information on general areas of development. All students, with the exception of students who have IEPs from CPS, must have current ASQSE2 scores entered into the appropriate system by the 45th calendar day. Calculate the 45th day for each student by using each individual student's start date. For example, if a student starts school on September 6, 2016, the 45th day would be October 20th, 2016. Therefore, that particular student's ASQSE2 score must be entered by October 20th. Scores for students in Head Start programs must be entered into COPA. Scores for all other funded programs must be entered into IMPACT. Guidance for how to enter scores into COPA and IMPACT may be located in the preschool handbook. Screening social-emotional development is important because research has linked early social-emotional behaviors with subsequent outcomes. Research has also found connections between early risk factors, poor outcomes, and violence. Research has determined that social and emotional competencies are formed through interactions with primary caregivers, parents, for example. Research to determine the levels of reliability, validity, sensitivity, and specificity were conducted on the ASQSE2. The normative group for the ASQSE2 was much larger than the original ASQSE. A total number of 14,074 children were included in the ASQSE2 sample. 3,014 children were included in the normative sample for the original ASQSE. Some parents completed multiple questionnaires on their children, which explains why there are more questionnaires than children. The sample mirrored the U.S. race ethnicity composite and included all socioeconomic groups. Data was collected from 2009 to 2014. As a result of the larger sample and added information, new cutoff scores were developed for the ASQSE2. How do we know the ASQSE2 is a sound screening instrument? The ASQSE2 recorded excellent findings for each of the 4 psychometric indicators that are critical to the soundness of any screening instrument. As you can see, there are several updates in the ASQSE2. The design of the questionnaire has been updated. New cutoffs based on a larger normative sample have been established. There's a monitoring zone which assists with score interpretation and follow-up. New behavior and communication items have been added. Some items and responses have been refined. Spanish translation has been refined. A quick start guide and parent engagement materials have been added. A learning activities book will be introduced in winter 2016. All questionnaires include open-ended questions that are not scored. The open-ended questions in ASQSE2 are very important. Any concern that is brought up in this section should be addressed. In order to select the correct ASQSE2 intervals, teachers should carefully calculate a child's age at administration in months and days. Refer to the user's guide for detailed guidance. Teachers may use the age calculator at www.agesandstages.com in order to determine a child's age in months and days. Once the age at administration has been calculated, the teacher can then determine whether to use the 36-month, the 48-month, or the 60-month questionnaire. The prematurity question only applies to ASQSE2 intervals under 24 months. The option does not appear on the 36, 48, or 60-month ASQSE2. Once the appropriate questionnaire has been selected, review the important points to remember section at the top of the page with parents so they can answer the questions as accurately as possible. The ASQSE2 now has a new scoring option. Often or always replaces the former most of the time. The check if this is a concern column now has a scoring code V indicated. The line to the right provides space to total each item. Staff should not provide their opinion about how to answer the questionnaire. Staff should encourage the parents to provide his or her best answer based on his or her feelings about his or her child's behavior. Staff should provide as little interpretation as possible other than to help the parent understand what is being asked. There is guidance in the ASQSE2 User's Guide. See page 93 of the User Guide. The section is titled Parent Concerns. This is related to the questions in terms of what types of behaviors would be of concern. Sometimes parents will indicate the presence of a behavior, but it actually is a typical behavior given the age of a child. For example, the question, does your child do things over and over and can't seem to stop? Examples are, parents can write in their answer. So parents may have written in things such as, wants to read the same book. After questioning the parent, you may realize this is just a typical 24-month-old need to repeat an activity over and over, rather than a perseverative or compulsive type behavior. Staff need to use their professional judgment in these cases. The ASQSE2 has more items asking for social-emotional competence than problem behaviors on each questionnaire. Example of competence behaviors include, does your child like to be picked up and held? Does your baby let you know when she is hungry, hurt, or wet? Examples of problem behaviors include, does your child hurt himself on purpose? Does your child have eating problems such as stuffing foods, vomiting, or eating non-food items? Depending on whether the questions are positively or negatively stated, changes the point value for each question. For example, does your child look at you when you talk to him? If the parents check the often or always box, the score would be 0. However, the question, does your child cry, scream, or have tantrums for long periods of time, would elicit a score of 10 if the often or always box is checked. The score sheet is coded so that you will not have to figure out how to assign points. Next to each answer box on the questionnaire is a letter, Z, V, or X. The score sheet will indicate the number of points assigned to each letter. Each ASQSE2 questionnaire has unique summary sheets. The summary sheet, along with the optional item response sheet, provides summary of the entire ASQSE2, as well as follow-up actions that are needed. Each summary sheet has 6 sections: child family information, score total, bar graph with cutoffs, overall section, follow-up considerations, and follow-up action taken. If you look at section 1, notice the scoring chart, which will be explained in the next slide. If you look at the questionnaire, you will see a small letter, X, V, or C, next to each answer box. Each letter indicates the number of points to assign if the box is checked. Remember that open-ended questions are not scored. Whether done as an interview, which is highly recommended, or parents complete the instrument on their own, sometimes parents omit items. Parents may not really know how to answer, or the question may be inappropriate to the family's culture or values, for example, questions related to child's knowledge of sexual language. It is important to try to find out why a parent omitted an item. Wherever possible, try to obtain an answer. It is recommended that no more than 3 items be omitted on any questionnaire interval in order to accurately interpret ASQSE2 results. If 1 or 2 items are missing, then proceed with the child's total score. Adjusting the total score will not change the interpretation of the child's score, i.e. the child's adjusted total will still be above the cutoff, close to the cutoff in the monitoring zone, or below the cutoff. If 3 items are missing and the total score of completed items is within 5 points of a cutoff, then adjusting the total score will change the child's result, i.e. results will move from below the cutoff to the monitoring zone, or from the monitoring zone to above the cutoff. If the 3 items are omitted and the total score of completed items is within 5 points of a cutoff, then the score must be adjusted. To adjust the score, first divide the child's total score for answered items by the number of items answered. This yields an average item score between 0 and 15. Then multiply the average item score by the number of unanswered questions and add the child's total score. This will provide an adjusted total score to compare with the cutoff of scores on the information summary sheet. Once the instrument has been scored, it can then be compared to the cutoff chart. If the child's score falls below the cutoff, the child is generally considered to be developing on schedule. Teachers should provide ASQSE2 activities and monitor the student. Teachers should also follow up on any parent concerns. If the score falls into the monitor zone, teachers should follow up on parent concerns, provide the parent with information, education, and support, re-administer the ASQSE2, and consider referral for evaluation, especially if the child is a girl or you see a lack of competence rather than presence of problem behavior in both genders. See pages 98 to 99 of the user guide for further explanation regarding gender differences and scores. If the child's score falls above the cutoff, the teacher may refer the child for further testing with the school assessment team to the child's primary healthcare provider or appropriate community agencies. The ASQSE2 is a reliable, valid screening instrument that assists teachers in identifying children who may need further evaluation in the social-emotional domain. Tools such as the ASQSE2 help bridge communication with families and assist in making referrals to community agencies. Keep in mind that referrals should be based on a variety of considerations in addition to scores. Development and social-emotional issues are very complicated. Teachers should use available resources to make decisions about what steps to take after screening.